people with diabetes may sometimes notice foamy urine. The foam in urine is often caused by proteinuria, which is the presence of excess protein in the urine, rather than directly by the diabetes itself. The foam usually indicates a decline in kidney function, which is a more serious concern. When kidney function deteriorates, it can lead to kidney damage and tissue death, often referred to as the kidney breaking down. In cases of chronic kidney disease, CKD, phosphorus builds up in the body, which increases the risk of cardiovascular disease and overall mortality. In fact, people with kidney failure due to diabetes have a 7.2 times higher risk of death compared to the general population. As chronic kidney disease progresses to end-stage kidney failure, the glomerular filtration rate, GFR, can drop significantly. When kidney function falls to a critical level, it can become life-threatening. The 5-year survival rate for patients with end-stage kidney disease caused by diabetes is only around 54%, which is lower than that of most cancers, excluding lung and liver cancers. The problem is that kidney dysfunction and chronic kidney disease often go unnoticed, especially in the early stages. Many people may dismiss symptoms as common signs of aging or simply not recognize them. In many cases, kidney issues are only discovered during routine health checkups. Particularly for people who have had diabetes for 20 years or more, kidney disease complications are quite common. In advanced kidney disease, the kidney tissues can become hardened and fibrotic, losing their ability to function properly. This is why it's often described as the tissue breaking down or dying. For people who have had diabetes for a long time, it is crucial to pay close attention to kidney health and monitor for signs of kidney damage. If there is foam in your urine, it could be a sign of kidney problems. While foam can sometimes be caused by factors like soap or the shape of the urine stream, proteinuria, excess protein in the urine, is often the main cause. The foam caused by proteinuria tends to last much longer, remaining even after 10 minutes, while foam caused by other factors usually disappears quickly. This foam is typically due to albumin, a protein that, when present in high amounts, can create bubbles. For people with diabetes, foam in the urine is usually not caused by the diabetes itself but by kidney function deterioration over time. Proteinuria often develops as a result of declining kidney function, and if foam persists for more than 3 months, it is important to seek a medical checkup. The color of urine can also indicate potential health issues. While a pale yellow color is normal, darker or cola-colored urine could signal a problem, such as kidney stones. People who frequently consume alcohol, meat, processed foods, caffeine, or carbonated beverages are at higher risk of kidney stones, especially if they don't drink enough water. These factors can lead to more acidic urine, which is a condition that promotes stone formation. On the other hand, eating seaweed and vegetables can help make urine more alkaline, which is beneficial for kidney health and preventing stones. While a healthy diet alone cannot guarantee kidney protection, it plays a crucial role in maintaining kidney health. Avoiding diets that focus heavily on protein, as these can worsen proteinuria, and instead incorporating high-fiber foods that help eliminate waste from the intestines can reduce the burden on the kidneys. Some beneficial foods for kidney health include red beetroot, contains betaine, which helps lower cholesterol, blood sugar, and blood pressure. It also promotes nitric oxide production, which helps prevent vascular blockages. However, it should be consumed in moderation as it can cause nausea and bloating if eaten in excess. Asparagus contains rutin, which strengthens capillaries, including the glomeruli in the kidneys, making it helpful for kidney function. It also aids in the elimination of uric acid. Black soybeans. Known for their high polyphenol content, black soybeans are particularly beneficial for kidney health. They can be consumed after soaking in water to reduce the absorption of certain substances like phosphorus. Seaweed, high in potassium and sodium. Seaweed has been shown to have protective effects on the kidneys in animal studies. It is particularly useful for those who do not need to limit their potassium intake. How to cook for kidney health. When preparing food to support kidney health, it's best to choose younger ingredients and lightly blanch them so that their green color remains vivid. For red beetroot, steaming for about 10 minutes can reduce its potential side effects while maintaining its beneficial properties. Instead of grilling or frying meat, it's better to opt for steaming or boiling, as cooking methods can influence the creation of harmful substances. Cooking methods matter because they can either promote the creation of harmful compounds or reduce them. For example, grilling directly over an open flame leads to a reaction called the Maillard reaction, which browns the food and enhances its flavor, but this process creates advanced glycation end products, AGEs, harmful compounds formed when proteins and fats react with sugars. AGEs contribute to inflammation, hinder blood circulation, and can accumulate in organs, including the kidneys, leading to conditions like arteriosclerosis. Grilling is the method that generates the most AGEs, followed by oven roasting and frying. Steaming or boiling produces significantly fewer AGEs, making them preferable for kidney health. Which fruits are good for the kidneys? Not all fruits are beneficial for kidney health. Fruits with high sugar content are generally not ideal, but fruits with lower sugar levels can be helpful. Many fruits contain antioxidants, particularly in their skins, which are rich in phytochemicals. These antioxidants help reduce inflammation and protect the kidneys from damage. Fiber-rich fruits also support smooth digestion, reducing toxins in the body and lessening the burden on the heart. The following fruits are particularly beneficial for kidney health. Blueberries and mulberries both are rich in antioxidants like anthocyanins, which help protect cells from oxidative stress, reduce inflammation, and improve overall kidney function. Papaya. Papaya contains lycopene, which can prevent heart disease, a leading cause of death among kidney dialysis patients. It also has high levels of vitamin C, beta-carotene, and lutein, all of which support eye health. Papaya contains papain, an enzyme that helps digest proteins, preventing undigested proteins from triggering immune responses that could damage the kidneys. It also helps with bowel movement, which reduces toxin accumulation in the body. However, overconsumption or unripe papaya can cause digestive issues such as diarrhea or stomach pain, so it's important to consume it in moderation and make sure it's ripe. Recommended fruit consumption for chronic kidney disease patients. If you have chronic kidney disease, it is important to choose fruits with lower potassium content. I have created a chart on my channel listing fruits by their potassium levels, which can be helpful. Fruits like blueberries and apples are relatively low in potassium. The most important thing is controlling the quantity of fruits you consume. Potassium levels are usually listed per 100 grams, which is roughly a handful of fruit. Since fruits are tasty, it's easy to eat more than you should. It's best to limit yourself to about 1 handful or 1 to 2 small pieces at a time. When eating apples, it's crucial to eat them with the skin, as that's where many of the beneficial nutrients are. If you peel the apple and only eat the inner flesh, you miss out on the healthy compounds found in the skin. For patients with kidney issues, it's better to divide your fruit intake into smaller portions throughout the day. A total daily potassium intake should be around 3,000 to 4,000 milligrams, and for those with hyperkalemia, high potassium levels, it should be limited to between 2,400 and 2,730 milligrams. You can calculate the total amount of potassium in your daily intake to ensure you stay within your limits. When it comes to fruits, watermelon ranks low in potassium, but it's important to remember that even a single large slice of watermelon can contain about 200 grams. Because watermelon is often consumed in large quantities, it's important to be mindful of the portion size. For those on tight potassium restrictions, soaking watermelon in water can help reduce the potassium levels. Canned fruit typically has less potassium due to the processing, but be sure to discard the syrup and only eat the fruit itself. The worst way to consume fruit is in dried form, as it not only increases the sugar content but also the potassium concentration. Dried fruit often contains additives that may have negative effects on heart health. Dried fruits can become harmful for those with kidney issues, as their potassium levels increase significantly. Vegetables and kidney health. For chronic kidney disease, healthy kidney management doesn't require special caution until stage 3. If you are in stages 4 or 5, however, careful monitoring is necessary. For stage 4 and 5 patients, strict management of potassium intake is essential. To reduce potassium content in vegetables, you can soak them in water. Submerge high potassium vegetables in water for about 12 hours, overnight, and for vegetables with less potassium, 2 hours is sufficient. Warm water works better than cold water, and it's important to change the water several times. Cutting vegetables into smaller pieces before soaking will help remove more potassium. When cooking vegetables, use at least 5 times the amount of water to boil or blanch them, and discard the water before cooking further. If you are making stews, cook the vegetables first, discard the water, and then add them to the stew. Fresh vegetables are better than dried ones, as drying increases the potassium content. Additionally, when selecting vegetables, choose younger or sprouted vegetables over mature ones, as they contain less potassium. By making these adjustments in your diet, you can help manage your kidney health. Please remember to follow a kidney-friendly lifestyle and eating habits to protect your kidney function.